Hello everyone, I hope you all are keeping safe and healthy wherever you are. Okay, welcome back again to this wonderful channel where we discuss everything about our health, A to Z, concerning our health and our well-being. Here we support styles of living that promotes our health and frown at unhealthy lifestyle. So if you're coming in here for the very first time, you are highly welcome. Just try as much as possible to watch, subscribe, share with your friends and your people, your loved ones as well. To my wonderful old subscribers, thank you for sticking around. I really appreciate you all. Thank you from my heart. Okay, so today I want to talk about a very important topic. It's very crucial, yeah, indeed, as long as life is concerned, and this is what basic life support. Basic life support. Of course, whenever we talk about this topic, people will think, it's all about the nurses and the doctors and other health care practitioners in the hospital. I can tell you that all of us are involved. Concerns all. We are involved in one way or the other. Yeah, because the early intervention or action you give to someone that is unconscious, or someone that just collapsed, might literally be the difference between that person's life and the person's death. This is very, very important. As long as life is concerned, we need to support our life. Yeah, and life-threatening situation can happen at any time, but even at home, at the workplace, on the way, maybe you're going to the market, you can see someone that just suddenly collapsed. Okay, it can happen at any time. So we just want to give, have an insight, or just to motivate ourselves, or to create sort of awareness of the steps we need to take when we encounter such, or when we witness such situation. Okay, that is why I'm here. We know most of this, but we need to act them because we are really important in the chain of survival. All of us are very, very important. We have our individual role to play in order to make sure that the victim recover very fast in the hospital, or the victim is preserved from further injuries or from worsening the situation. So all of us are involved. That is essence of today's discussion. All right, so before we proceed, I would like to have an overview on what anatomy of respiratory tract and the heart, before we now differentiate between the heart disease and cardiac arrest, because most people used to misinterpret both of them. Yeah, when somebody has a heart attack, there are symptoms you will see. You say this is heart attack. Then when somebody is arrested, maybe cardiac arrest, there are some symptoms that the person will display. You say this person is having cardiac arrest. This is very necessary because this will guide you in your actions as well. Okay, the approach differs as well. So let's dive right in without wasting much time. Okay, back to basics. We know that breathing, taking in oxygen is very vital to sustain life. When we breathe, we take in oxygen and exhale carbon dioxide. Okay, by the process called gas exchange that takes place in the lungs. When you talk about respiratory system, we have the upper respiratory system and lower respiratory system. The upper respiratory system concerns those organs that are located outside the chest cavity, something like the nose, the pharynx, and even the larynx. They are located outside the chest cavity, while the lower respiratory tract contains those organs that are within the chest cavity, like the lungs, the trachea, and all segments of the bronchi. They are in there, and that is where the gaseous exchange takes place. That is where the exchange takes place, and we should remind ourselves that this is only way the body can access oxygen to get oxygen to be used in the bloodstream, to get oxygen into the bloodstream for other cells and other organs to use. Okay, this is the only way the body can get access to oxygen. Okay, so we've done this. Let's talk about our heart. Heart is a very hard-working muscle, always working, is always beating. Okay, even when we are asleep, our heart is continuously beating. Okay, then is a sophisticated pump that is being controlled by electrical impulses or electrical currents. Those electrical currents are controlled by our brain. So what happens is that our heart is always beating and all the time in order to pump blood throughout the whole circulation. If your heart is not beating, my dear, you are dead. That is just the simple truth. Okay, That is just it. So our heart, it beats all the time. Our heart beats all the time. So an average man's heart beats about 80 beats per minute. Okay, which equates to 115,000 beats in a day. And research also said that it should be around 42 billion beats. 42 billion beats in a year. Depending on your age, you can calculate how many times your heart has beats already. So this is just it. Yeah, so our heart is always beating at all time. So now I want us to talk about the chambers of the heart. The heart comprises of two sides, the left and right, and chambers, about 4 chambers, left atrium, the left ventricle, the right atrium, the left ventricle, and they are all at work, but they work in harmony. They work together to see that the contraction is very, very effective. Okay, the blood and the whole circulation will get into the heart through the right atrium. From there it will go down to the right ventricle through the tricuspid valve to the right ventricle. From there it is now pumped through the pulmonary artery to the lungs. When it gets to the lungs, I told you that the gaseous exchange takes place in the lungs. So from there, the oxygen that is there will be transferred into the blood, while the carbon dioxide in the blood will be transferred to the lungs. Then the blood that will come back to the heart now is well oxygenated. It will come back through the left atrium, from left atrium to the left ventricle. From the left ventricle, the whole blood will be now pumped through the aorta into the general circulation. This is what happens in the heart, and this is a continuous process. It happens every time. Okay, that is why the heart will never stop beating. Okay, so what happens when the heart now stop beating? You remember in our video about cholesterol, we talked about bad cholesterol and good cholesterol. Some people that have too much of bad cholesterol can be predisposed to some heart problem, because the bad cholesterol will say something that they causes a lot of plaques build up around the blood vessels. Okay, when these plaques becomes too much, when the buildup becomes too much, it will block or narrow down the blood vessels, especially the coronary arteries. So sometimes some of these clots or some of these plaques might dislodge and block the main arteries. Example, the arteries of the heart. Okay, when such thing happen, it causes what we call heart attack, because the blood supply to the muscles of the heart will diminish, will become small. Therefore, the muscles will suffer lack of oxygen and lack of the basic nutrient. And in that case, the person will be having chest pain, because the muscles of the heart is suffering. They're not getting enough nutrient. They're not getting enough oxygen. They will enter agony. They will be in pains. The person will be sweet, having some symptoms like very, very severe chest pain, tightening and squeezing sensation in the heart. Sometimes they will feel sick, they will want to vomit, some of them even vomit. Sometimes they'll be having generalized body pain, because the pain might radiate to other parts of the body, the upper arm, the lower arm. The person will feel generally unwell. You'll be having severe, you see the person just holding her chest as if the chest is about to burst. This person is having heart attack, because some part of the blood vessels, coronary arteries, are being blocked. So that means that the blood is not flowing to the heart very well. There's no efficient blood supply to the heart, and the heart is suffering at that point. Okay, so the basic sign you will see now is what? Chest pain. The pain will become too much, unbearable. The person will be pointing to her heart. Oh, my heart, oh, it's about to burst. The person has chest pain. Then another thing is that they may be sweaty. The person might be sweating. They might have clammy skin. The skin might become cold. Then you will see some of them being overwhelmed with panic and pains. Or don't know what is gonna happen, because they are in pains. Their heart is about to burst. Then these are just the few signs you will see. All right. When we talk about cardiac arrest, in this situation, the heart suddenly stop beating. And when this happens, the blood supply to the brain fails, because the heart is not pumping. The person will become lifeless, unresponsive, no movement, no breathing, and sometimes even when you call them, shout at them, pain stimulus, no response. Person will become lifeless, unconscious. This is cardiac arrest. The person is arrested. Okay, these are just the basic differences. That means that when I told you that the muscles of the heart respond to electrical impulses that is being controlled by the brain. Some of these impulses is what trigger the contraction of the heart. Okay, so in cardiac arrest, it's mostly the problem of the electrical impulses, that causes some abnormal contraction of the heart. From there, the person will not enter into unconsciousness. So what happened there is the person become unresponsive. So now this will take us to what is our responsibilities. Okay, we've known their symptoms, we've known their differences. What is our responsibilities? The aim of this phase A is just to preserve life. The second aim is just to promote the condition from worsening. The third aim is just to promote recovery. Even when the person is taken to hospital, the chances of recovery will be increased if you initiate this phase 8. If you initiate this early intervention, early response, the person will recover very quickly from the hospital. Okay, so let's talk about the chains of survival. Chains of survivals are just about four steps that are interlinked. When we deliver care with those steps, and especially when they come in sequential order like that, it promotes recovery. It optimizes person's recovery from the hospital, even if the person finally gets to the hospital. Okay, so first link there is early recognition and notification of the ambulance service. Being able, maybe you are in a scene of the event, maybe you're in the market and somebody suddenly collapsed. But the fact that you've seen those signs, we just said, oh, there's no response, there's no heartbeat, this person is not moving, is not responding to call. This is cardiac arrest. You have to pick your phone, dial 999 or 112. All right. You don't need to panic too much. Just dial them, tell them that you are in a social place, and they think that one of the person around you now, maybe might not know the person's name, is arrested. The person is having it suddenly become unresponsive. Is having cardiac arrest. So they will come and respond to him. Then in the meantime, while you've already made this call, the second stage is early CPR. CPR is just chest compression. Yeah, it's a series of chest compression that help the heart to supply blood to the vital organs as you are waiting for the ambulance to arrive, just to buy time, to help the heart to compress. You compress the heart at a rate of 100 to 120 beats per minute, or about 30 to 2 rescue breaths. If you can't give rescue breath, we can just compress the heart. Hold your hand like this on the chest wall, compress the heart 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 120 times. If you can give rescue breath, you will compress and give 2 rescue breath after 30 compression. Okay, that helps a lot. It helps a lot. It doubles the survival. Okay, so even when you are compressing, somebody can alternate with you depending on where you are. If you don't have any water, we'll just continue compressing until the ambulance people arrived, or maybe you are tired. Okay, or maybe the person shows signs of recovery. All right, so these are just the basic things. The third person in the chain of survival is initiating early defibrillation. I told you that one of the causes of this cardiac arrest can be ventricular fibrillation. Initiating early defibrillation. As you're already doing your CPR, okay, you can initiate early defibrillation with either using AED, what we call automated external defibrillator, or you can use public access defibrillator. These ones are in public places, especially in UK. You can use it to deliver some shocks to the heart. It's able to pick up some rhythms of the heart very fast, and also to deliver some shock. It has prompts, so you don't worry about that. Once you get the machine, then it will direct you on what next to do. Just follow the prompts, the voice notes, the voice messages. You are good to go. It will tell you when to compress, when to deliver the shock, when to do everything. Is self-explanatory. Okay, it's not a problem. If you don't have it, don't worry. Continue with your compression. Okay, continue with your compression until the person recover, or until you feel tired, or until ambulance service are there. All right. Then the next person there is the early advanced care. This one is being delivered by the ambulance team. When they come, they will come with set of their observations and their resuscitative equipment, their oxygen. They will observe the person, initiate the resuscitative measures, the injections, and other stuff like that. These are for them. Okay. Then you see that you've already done a lot. You've already done a lot. If not you, nobody will alert the ambulance people, nobody will give the CPR, nobody will initiate defibrillator, okay, until the ambulance comes. You can see someone might have died before the ambulance arrives. That is why I said this course is very important. It's just to equip all of us. We are all important. You mustn't be a nurse, you mustn't be a doctor to do it, you mustn't be a pharmacist to do it. Okay, you can just learn about it, how to give emergency care to people in a life-threatening situation like this. Okay, we've already known all this, and in conclusion, we've known the basic differences between heart attack and cardiac arrest, where we say that heart attack occur when there is a blockage to blood supply to the heart muscles. In that case, the muscle will begin to die. All right, they'll begin to suffer deficiency because there's no oxygen, there's no nutrients. All right, and when such thing happen, the person will display some symptoms, having some tightening or squeezing or painful chest pain. All right, effect on the pain on the chest, having a very severe pain. All right, the person might be having sweating, it might be sweating, the person might be even feeling feeling vomiting, or like even vomit as well. Some of them will even vomit. Then some of them will even feel that panic. They will overwhelmed with panic feeling. Oh, I don't know what might happen next. Okay, what you do in such situation, sit the person up. If the person is just having an attack, sit him up, reassure him, monitor him, get ready to initiate resuscitation in case if the person collapse, because heart attack is the junior brother to cardiac arrest. Heart attack is junior brother to cardiac arrest. Someone can have series of heart attack, before you know it, the person will have cardiac arrest. Okay, although heart attack is some sort of a plumbing problem. When there's a blockage in the hole, it's a plumbing problem. Why cardiac arrest is electrical problem. It has to do with electrical connection, current, that the things that initiate current in the heart, things that initiate contraction in the heart muscles. Okay, so then coming to the cardiac arrest, we all say that if someone is arrested, the person will become unresponsive, the person will have no breathing, the person will have no movement, the person will have no response, both to painful stimulus, both to calls, both to there won't be any spontaneous response, of course. Okay, so that is just the basic differences. All right, all of us are very, very important, and we need to act very fast. All right, act very fast, because the more you delay, any 1 minute you delay to somebody that just collapsed will reduce the chances of that person recovering, even when the person is sent to hospital. Okay, these are just the things I want us to discuss today, and I hope we've already make some points. We've already learned a lot of things from it. Okay, thank you so much for listening. Share this video so that people will learn how to act in emergency, in life-threatening situation like this. There's some people in my country, if you are in Nigeria, if you are in a country where there is no a good system where ambulance can easily come to to your house to pick up the person, you can easily carry the person to the hospital, or you can shout out for help. Someone will come and help you to take the person to the hospital. All right, don't just stay there and say, hey, I think he's an attack from this place, attack from this. Yes, these are just misconception. All right, they are just misconception. Just do the ones you're supposed to do, leave the rest off. Okay, yeah, thank you so much for your time. Thank you so much for listening. I do appreciate you, and I will see you again next week. If you have comment, question, let me know down there. Okay, thank you. Bye.